Hello and good evening. I hope that we're now have gone live on Facebook and YouTube. Welcome to this Facebook Live and YouTube Q&A around medication reviews and sort of making sure that you're always ordering your prescriptions on time. My name's Joshua Brocklebank. I'm one of the practice pharmacists at AWC Modality, and just to let everyone know who's watching that we are predominantly from AWC Modality and speaking on AWC Modality's sort of policies and the way that we use the systems here. However, there will be obviously opportunities and things that sort of relate to how you can potentially order things there. So I'm one of the practice pharmacists, and I'm joined by some of the other team from here. Our plan today is to go over understanding your reviews, why you have them, and we'll obviously go through that very shortly. Just quickly, whoever's joining us, I hope that you enjoy yourselves and hope it's interesting. But please start putting questions in the chat. We will, at the end of this presentation, go through all the questions and make sure we answer everything that we can. And obviously, if we can't, we'll explain potentially why we can't. So just to sort of pass on, as I said, my name's Joshua Brocklebank, and then we've also got some other people which I will let them introduce themselves. So, Usman, do you want to go first?
Yeah, of course. So, my name is Usman. I'm a pharmacist over at Modality. Yeah, Josh. So I work across the division, and I work throughout all the sites, and yeah, we do quite a lot of things such as reviews and medication queries and that kind of thing. Yeah, we'll hopefully explain a bit more as we go on. Matt.
My name's Matt. I'm the prescribing team lead for AWC Modality, looking after the practices there.
Perfect. So,
Yeah. So just to summarize what we're going to be going through in this presentation today. So there's going to be a few things we're going to go through, and there's also going to be a Q&A at the end. So the role explanations of pharmacists and prescriptions team. So what we do and why we do it really. So the medication reviews is a key part in ordering medication and getting patients medications. So what we want to take you through today is what's in a medication review, why we do the medication reviews, and also the long-term condition review. So some patients who have medication reviews, they're taking those medications for long-term conditions. So we'll be taking you through the long-term condition part of the reviews as well. And we're also going to be talking about how to order your medication. So we have Matt here, who's our prescription admin team lead, and he'll be talking you through the main ways of ordering your medications, the different ways of ordering your medications, and also some little hints, some tips and tricks to order your medication. Now, the majority of the content we're going to cover in here is going to be AWC related, but you may find that for the patients who are watching from nationally, you may find that some of it does also relate to your practices as well. And there's going to be an opportunity for Q&A at the end. However, we do encourage you to submit your questions throughout, and we will be keeping an eye on questions and answering them as best as we can.
Perfect. Thank you, Usman. So I'm going to pass over to Matt now to talk through what the key parts of being a prescribing admin team member is and what his team is mostly responsible for.
Thanks, Josh. Yeah, so the prescription admin team, we're kind of the first point of call really for all your requests, all your queries, things like that come into the practice every day. We're a relatively small team. There's just less than 20 of us, quite a lot working part-time. And between us, we do actually go through approximately 2,000 queries and requests per day, which is sometimes a little surprising to people, but it's that many. But yeah, 2,000 per day, up to 10,000 per week that we're dealing with within our small team. Obviously, the majority of these queries and requests, they come from patients, but we also have many queries from places like care homes, nursing homes, And then, of course, all the community pharmacies that eventually dispense all your prescriptions. We deal with all their problems, any out of stocks, any supply problems, anything like that, basically. So things that we can do within the team ourselves, we can make sure that you get any early supplies that you might need if you're going on holiday, extra medication if you're going on an extended holiday. Perhaps you've lost some tablets and you can't find them, and you know it's too early to order them, but you've misplaced some tablets. We can help you with that. Obviously, we deal with all your repeat medication requests, which do include some of the high risk drugs, which require a bit closer monitoring with blood tests and things like that. As I said, the out of stock medications, we deal with that. And also we will be the people that will help organize your medication reviews. We'll point you in the right direction of the correct clinician that you need, and deal with that. So essentially what we do is kind of navigate the requests that come in. We make sure that each request goes to the person that it needs to go to. And obviously we try and do that in as quickly as time as possible for you, so as not to hold up your prescriptions. And as it says at the bottom, obviously there's going to be things that are outside of our scope. So you know, we know where we need to direct to a GP, a pharmacist, a nurse, etc., etc. Thanks, Josh.
Yeah, I think it's really important to sort of understand that the most important thing the prescription team deals with is they are the first point of contact when it comes to prescription requests. They really do help everybody else in the team be more efficient. They, especially as a pharmacist, they help filter the appropriate things through to us and deal with the things that they're able to. And it's absolutely brilliant to have them to do that with us. And that sort of leads on quite nicely into the next slide, which is about the pharmacy team. And obviously, pharmacists have been popping up more and more often in GP surgeries. And we actually, similarly to Matt, have quite a big team of pharmacists. We have about 15 to 20 pharmacists, about the equivalent of one full-time pharmacist per site that we have in AWC Modality. And I know that across the rest of Modality, there are also pharmacists sort of becoming more and more integrated into sort of the service that's provided by a GP surgery. And a lot of our key responsibilities predominantly lie around annual medication reviews. So we deal with an exceedingly large number of medication reviews in a year. We deal with, I think it was about, when we did the maths earlier, it was quite a few. We do about 150 medication reviews a day, which obviously over a week and then a month goes up really quite quickly. So over a week we have 5 days, so that's close to sort of 700 and close to 3,000 medication reviews a month that the pharmacy team is managing. And this can be any patient who has medications on repeats, as well as any care home patient, as well as sometimes patients who are housebound and things like that as well. The pharmacy team at AWC Modality also in this last year has been taking on managing vascular conditions quite considerably. So if you are somebody who suffers potentially had a previous heart attack or a stroke, or maybe you have atrial fibrillation, we do a lot of the management in terms of making sure that your blood pressure is optimized, as well as also making sure that your cholesterol levels are correct. So you probably had a call from us if you noticed that. We also deal with all the medication requests that come from Matt's team, but also all the medication requests that come from other teams potentially, if they're something that Matt's team can't deal with. So whether that is medications that aren't on repeat, so maybe an acute supply of something, maybe like a steroid cream, maybe that you use when your eczema flares up, or maybe an inhaler that you don't use very often. Those are the sort of things that we sort of have an opportunity to review your patient notes and sort of check to see if that's suitable to be issued, so that we don't have to use up GP's time, because that's the ultimate aim of all of us being involved in the GP surgery, is to save as many GP appointments as possible. And when we do 3,000 medication reviews a month, that is ultimately what used to be the GP's work. So that's 3,000 appointments more a month that are available for GPs to do other queries and deal with things like that. We also deal with things when things go out of stock. Post-Brexit, there was a whole bunch of things that potentially went out of stock. So we were dealing with quite a lot of different things, whether it was insulins, HRT, all sorts of things like that. And we also deal with medication queries. And these queries can be anything. They can be from anyone, whether that's GPs, whether that's patients, whether that's other members of the team, whether that's the prescription team, all of those queries that are sort of things like, does this tablet have any lactose in it? That's the sort of thing that we can deal with really quite easily and sort of have the resources to be able to find that information, or things like swallowing difficulties as well. Also on the side, we do quite a lot of the audits and safety reporting, and involve quite a lot in the high-risk drug monitoring as well. And another big part of our job is that we process, with the support of our pharmacy techs, all of the clinic and discharge letters that come into the surgery. So any letter that comes from a consultant, any letter that comes from that private clinic you've seen, they all come through to the surgery, and they're processed predominantly by our team usually. So moving on to the next bit, which is about what is a medication review. And I'm going to pass back to Usman to manage that.
Yeah, so one of the things that Josh explained very well was that we do is medication reviews. So a key part of prescribing medications is making sure we're prescribing them safely, making sure that the checks are up to date, making sure that that the medication that we're giving you is going to be, you're going to be getting the best effect from it, and sometimes optimizing it, sometimes changing it, sometimes maybe even stopping it if we don't feel it appropriate. So we try to do the medication reviews every year, and what we've tried to do is we try to link it up. So some patients suffer from, and I'm not going to touch upon this because Josh is going to go into this in detail in the next few slides. So one of the things that we've noticed is that some patients have long-term conditions. Now, patients who have a long-term condition, they normally will have a long-term condition review and then a medication review. So what we try to do is we try to line the medication reviews up so they're done alongside or after the long-term condition review, and we do those annually. And some of the things that we'll check in a medication review is we'll check the adherence. Are you taking it how you should be? Is it being taken every day? And if it's not being taken every day, why is it not being taken every day? So sometimes some patients might have a swallowing difficulty. There could be numerous reasons for adherence not being as well as it should be. So it's something that we try to manage. We try to check if it's working well, if it's the right medication for you, or is it something that we need to be amending. We'll also check the monitoring. So some medications will need us to check your kidney function. They might need us to check your liver function, your blood pressure. We will check everything's up to date and that it's still safe to be prescribed, and also that there's no side effects or concerns. That some medications have more side effects than others. Some patients might get side effects that others may not. So it's quite important just to check in with yourselves and make sure that you're not having anything untoward. And if you are, to manage that as best as we can. We like to check that patients are aware why they're taking the medications. Sometimes the medication is left unchecked and it's been on there for a while, and it might be the case that it's not needed anymore. So to reduce polypharmacy and to reduce the risk of high tablet burden, we will check patients to understand why they're taking the medication and make sure that it's still needed and it's still indicated. And if it isn't, we will then see, can we remove this or can we reduce this? But yeah, so what we're trying to do is we're trying to optimize your medication, and we're trying to make sure it's still required and also that it's safe to be used. It also offers patients an opportunity to talk about the medication, to ask about the medication, to bring forward any concerns about the medication, and it's just an opportunity for patients to ask about the medication. So once we've done the medication review, what we will do is we'll reauthorize the medication for 12 months, and that will then update on the. So some patients order on the NHS app. So with the NHS app, if you pass your medication review date, it might show as not being available to order. Now, that doesn't mean that we've stopped your medication. However, the app is run by NHS England rather than ourselves, and it is something that we have fed back to NHS England, where it appears that your medication isn't there. However, it's not something that's been stopped, and if that ever does happen, we would urge you either to order it by leaving a note or order it by one of the other methods, which Matt will touch upon later on in the presentation. If there's something that we don't feel we can deal with, we will escalate that to the GP or whoever is suitable to deal with it. However, more often than not, we are the best people to speak to in terms of managing your condition and managing your medication. We want to move on. Thank you, Josh. So why do we do medication reviews? Why are they important? So, as I briefly touched upon in the last slide, the most important thing is patient safety. So there's certain medications that we have to monitor your observations for, you monitor your blood test for. Now, there are some patients who might not get the annual call. There are some medications that we do what we call a level 1 review with them. So say if a patient's on an emollient cream or a patient's on a lubricating eye drop, it might be that you don't need a telephone call. It might be that we can look at your notes and we can do a medication review from your notes. So for some patients, you might not necessarily get a phone call. However, for the patients who we believe we need to speak to them to check that there's no red flag symptoms, to check that your bloods are up to date, to make sure your blood pressure is up to date, to ensure patient safety, we will call quite a large amount of patients. I think Josh mentioned the number earlier. It's about 3,000 reviews a month that we're doing, which is almost 40,000 a year. And if you think previously, before we started doing this, those were all GP appointments. So the amount of GP appointments is freeing up. It's a significant amount. So again, a medication review is done approximately every 6 months, and when done, it's reauthorized for, sorry, not every 6 months, every 12 months. It's done annually, and it's reauthorized annually. It says again, it is always done. It might be that you don't always get a contact from ourselves, but if you've not been contacted, it's likely that we've done a level 1 review and we've reauthorized it from your notes. It's a way of making sure that we're both happy, that we're happy with the safety of the medication, and that you're still happy taking the medication, and that the medication is still doing what it needs to be doing. It's not causing you any ill effect, any problems, any side effects, and that you're still getting the best treatment possible. Yeah. Thank you, Josh. I'll hand it back over.
Yeah, I think it's a really good point. Obviously, the big thing is that we're trying to prioritize your safety on the medicines that you're taking. Drugs are by nature affecting the way your body works, and by that, what that means is that sometimes that cannot do what we want it to do. Most of the time, it does exactly what we want it to do, whether it's a blood pressure tablet bringing your blood pressure down, or whether it's a medication to manage your thyroid that's controlling your thyroid. But with any of those medicines, there is always things that we have to look out for if they're stopped working or if they're not working how we want them to be working, which is why it's really important that at least once a year, we're having a thorough check of your notes and checking and making sure that that review's done. So the next thing I'm going to be moving on to is sort of the long-term condition review process. Now, we call it the LTC process here at AWC Modality. This might be slightly different at other sites, but ultimately, I know that across Modality, this is something that we're focusing on in terms of making sure that our highest risk patients are sort of being correctly monitored and reviewed on a regular basis. And the big thing about the LTC process is our priority is making sure that every single patient gets the most qualified member of staff to do each part of their review. Now, the LTC process can take multiple appointments. Unfortunately, because we need to make sure that your blood tests and your blood pressures are on the system before we then check whether the tablets are doing their job, we can't ultimately have the conversation saying, yes, the tablets are doing their job before we know that your blood pressure and bloods are in range. So it's important that we obviously keep a good check on that before we have the conversation about whether it's working. We aim for these to be around a person's birthday. What usually happens is the month before your birthday, you'll get a text message to sort of get in contact to start the process off. And the main conditions that we sort of monitor with this is type 2 and type 1 diabetes. More so type 2, because type 1 tends to be managed by the specialist services offered by the hospital usually. We also do COPD and asthma. So these are obviously respiratory conditions, and we have a lot of very talented respiratory nurses who deal with a lot of those reviews. We then have hypertension or high blood pressure, which is predominantly managed by the nurses, but the pharmacist team will also get involved if things aren't quite to target. Sometimes we're the ones that will do the titrations of your medicines, as I mentioned earlier. And then the vascular conditions, which I did mention earlier on the slides, is a lot of the patients who have potentially post a heart attack or a stroke, or have had atrial fibrillation, had chronic kidney disease, have some other vascular conditions that need monitoring. We're involved in sort of making sure that you're having your annual blood tests, making sure your blood pressures are in range, and making sure everything's at. The last one that's on here, which applies to less people, is the severe mental illness reviews, which is anybody who's been diagnosed with sort of a severe mental condition, we are more conscious about the fact that we have to monitor their health as well, because they're at higher risk of deteriorating health in a quicker period of time, which is why we also monitor those. So, as I said, it can include multiple appointments and reviews with different members of staff. And the priority there is making sure that the best and most qualified person is there to do each step of that. And that starts off with, it's usually about 3 steps. Some of them are slightly less, some of them are slightly more, but usually about 3 steps. A month before your birthday, you should get a text message or a letter asking you to arrange an appointment with our HCA or a healthcare assistant who is part of the nursing team, who will do up-to-date monitoring. So that is usually bloods, blood tests, blood pressure readings. Sometimes if you're diabetic, they'll do a foot check. They'll also do, if they need to, a conversation about lifestyle, find out whether you're smoking, find out if you're drinking alcohol, and have a brief conversation around sort of those questionnaire style questions. And that will then get added onto the system, get reviewed by the doctor. So the blood test results will get reviewed by the doctor and filed. So at that point, we're checking to see if there's anything that's out of range. So whether that's a kidney function that's gone out of range, whether that's a liver function, whether that's your cholesterol's gone crazy, whatever it is, that's when we check that. Then, based on your results from that appointment, you'll then get an appointment with either a specialist nurse or the pharmacist, depending on the condition. So the diabetic reviews tend to be done by diabetic nurses and sometimes GPs if they're really complex pharmacy or really complex diabetes patients, whereas the COPD and asthma tends to be managed by the respiratory nurses. And that they are sort of have done extra qualifications and are very, very aware of the current guidance, current sort of up-to-date information on how best to manage your diabetes and your COPD and your asthma. As I said, the vascular reviews are managed by the pharmacists, so we'll be the ones that get booked an appointment next. And then once you've had that appointment, if everything has sort of been signed off, your COPD is stable, you don't need to change any of your inhalers, then it'll be up to the nurse to reauthorize that medication, and they will complete the review process. And that will mean that your medications are then reauthorized all the way through to your next birthday, when you'll then need your next review. The complication comes in is if you have other medications that aren't part of that long-term condition. So for instance, let's say you have COPD, you have your steroid inhaler and another inhaler, but you also are suffering potentially with a high thyroid or an uncontrolled thyroid, in which case you'll be on another tablet for that. Now that review would have to happen by the pharmacy team, and that's where potentially you'll end up with an appointment to have your blood test done, an appointment with the nurse, and then an appointment with the pharmacist. And the pharmacist sort of finishes it off, tidies everything up, and sort of goes over all the other medications that you might be taking. So whether that's your antidepressants, painkillers, thyroid medications, just to name a few of them, as well as also the things we mentioned earlier, like your emollient creams, your steroid creams, anything else that you're using on a sort of regular basis that's on your repeats. So that then means that we'll then do that final review, reauthorize your medications, and the idea will be at that point, once that review is completed, that should have all happened within your birthday month, and then everything will get reauthorized for a full 12 months through to your next birthday. Now, obviously, the system sometimes doesn't work exactly as we want it to, but that's always what systems happen. But that is the aim of the process anyway. So we're going to move on to sort of how to order medications. And just to say, we can see some questions coming through. We're almost through the presentation. We will move on to the slides shortly, move on to the questions shortly. So I'm just going to pass back to Matt, who's going to talk us through the 3 main ways that we recommend people ordering their medications. I can't hear you, Matt. Try again. Seems like the sound's gone from your microphone, Matt. So I'll just talk through. So we've got obviously 3 main ways that we order medications and prescriptions here at the surgery. We've got Voice Connect, which is a 24-hour medication ordering phone line. Now, this is something that we have more recently introduced. And this, although these apply to AWC Modality, I know that Voice Connect has been introduced across all of Modality surgeries. The idea behind this is that anybody can order your medications as needed. It's a 24-hour automated phone service, and basically you call up and then you have to put some information in, but then it lets you order any of the repeat medications that are on your repeats. We personally are on System 1. So some people can order their medications online using the NHS app, or sometimes using System 1 online for patients' records. And that can allow you to order your medications that are within sort of needing the reviews. And then there is also always an option to do a paper slip dropped into the post box outside the surgery. Now, that obviously that can sometimes take a few extra days to process, because it takes time for them to potentially be taken out of the post box, and obviously we only empty that once or twice a day. So we usually try and recommend, if you can, and if you're able to use the online or the Voice Connect options. So in terms of some tricks to make sure that you can always order your medications as and when you need them, a big one is making note of when your last review was. Obviously, we aim to try and get reviews done for birthdays, but make note of when your last review was, because if you are somebody who doesn't have a long-term condition, your review date isn't necessarily linked to your birthday. So that can be sometimes, can just be any time of the year where you last had a review, but legally we have to do a review every 12 months. So we'll be able to reauthorize your medications for 12 months. So if you take a note of when it last happened, so let's say it happened yesterday, you put a date in your calendar for next year, for sort of beginning of November next year, so that you know to get in contact to arrange that review. Otherwise, it waits for us to sort of get to the point where we realize that your review's due, and then we get in contact, which could be the end of November when you try and order the prescription and it's not available to be ordered. Also, the community pharmacy are a great resource. They can always tell us when your review is due. They can see on the system when your repeat templates are reauthorized through to, so they can tell us when, or they can tell you, patient, when your review is due. And for high-risk drugs, there are obviously specific monitoring requirements. So a lot of the medications that potentially the rheumatology team use or the gastroenterology team use require sort of 3-monthly monitoring. And that requires sort of blood tests on a 3-monthly basis, as well as potentially sometimes we have to monitor. So for some of the ADHD medications, we have to monitor blood pressures, weights, heights, things like that, to make sure that they're not affecting growth. And then in terms of the last tip, the best thing to do is to try and order your medication up to a week before you run out. So you can order it as sort of up to a week if you want to. That obviously gives us the most time to get it ready and obviously get it over to the pharmacy, so they can obviously get it on to their system and ready to be collected from you from the pharmacy. So I think that's everything. So I think that's everything we were going to go through on our slides. So we're now going to sort of move over to the Q&A. The first question that we had, which actually came in before the Facebook Live went live, was a question from a patient saying, I'm wondering if you can help. I want my prescriptions delivered, to see how I would go about it. Firstly, unfortunately, the deliveries of prescriptions is decided entirely by the community pharmacy. So you'd have to speak to your community pharmacy about their process for delivering, and also talk to them about whether there's something that they're able to provide for you. The next question, which is a really good question, which is from another patient saying, why is it that I can't order my prescription when I'm needing a review? And I wondered if, Usman, you could jump in on that one?
Yeah, of course. So I believe the question was about the patient was trying to order on the NHS app, and because they were due a review, they couldn't see that item that was needing a review on the app. Now, unfortunately, as I mentioned earlier, the NHS app is a national app. It's run by NHS England rather than ourselves, and it is something that we fed back to them. So what happens with the NHS app is when you order your medication, you can keep ordering it until the review date is due. However, once the review date is due, sometimes the medication is grayed out. Sometimes you can't see the medication that's due a review. However, there's normally a comments box or a box with, say, notes. So what we'd recommend is that there's a couple of things you can do. Is you can put a question via the comments box, because the medication itself hasn't been stopped. We wouldn't stop medication without a clinical need to stop that medication. So you can put a request in via the comments box, or we have the online access. So if you're in need of a medication review, you can use online access and select I need a medication review. And when you do the notes for that, again, you can say you need a medication review and you also need your medication. And while it might take us a few weeks or a month or so to get you in for a medication review, we will make sure you get your medication much sooner.
Yeah, I think it's important to also mention that obviously we use a system called Clinic here at AWC Modality, but different surgeries might use different systems. The next one the next question that came through was about why don't you automatically issue 3 months of a prescription if someone has a chronic stable condition and having a 3-monthly blood test? It could save a lot of time and save a lot of sort of energy from the pharmacy team potentially. I wonder if Matt's mic might be working now. So do you want to try again, Matt? No. So I have actually had a conversation with Matt earlier today about this. And because we were talking about potential questions that were going to come up. And this is one of them. So we are actually currently looking at a high-risk drug process. Currently, the way we normally run it is we have to we can allow patients 3 months supply in the sense of 3 monthly issues. And then we have to make sure before the 4th issue that a blood test has been arranged. This is something we're trying to work on to sort of improve a little bit, because we do know that it's very frustrating to patients who are stable and wanting to stay on the medications and obviously not run out of them, that we want to try and make sure that they're able to get their medications when they need them. The difficulty is we have to prioritize safety predominantly, and which is why we have to do regular blood tests and make sure that they're not going out of range, because ultimately with the higher risk drugs, it can be that those sort of can affect that and affect maybe your kidney function, your liver function, or even your blood count. So we have to keep an eye on those. I hope that answers your question. So the next one came through from a patient saying he had a recent blood test done, and one of his blood test results, his EGFR, which is his kidney functions, had been a bit abnormal, and these haven't been discussed with any doctor. Do these blood test results need further review? Do they need sort of a further investigation? Usman, do you want to take this one?
Yeah, no, definitely. So all blood tests, when they come in, are reviewed. Majority of the time, they will be reviewed by the GP or an advanced practitioner. So your blood tests will have been reviewed. However, without going too much into a specific case and talking about your EGFR, so your blood test results can be seen, and when we're doing the review, we will be looking at your EGFR. It's one of the parameters we look at, and we will look at how that affects the medication you're taking. And sometimes what happens when your EGFR is dropped, it might mean that we need to start you in a lower dose, or when we increase slower, or there's a maximum amount of something you can be taking. So it is something that we will look at, and it is something that we will review, and it is something that's also reviewed when the GP sees the results.
Yeah, I think it's also important to note is that blood tests are only a snapshot of exactly what's happening with your bloods at that very one moment. So what can happen is if you happen to be specifically dehydrated on one day, your EGFR results can be slightly abnormal. And a small change in EGFR is not something that requires a full review. It just needs something that potentially we need to monitor. So it might be that the GP will say that they want to do a repeat blood test in 3 months' time, just to check that the blood test result has come back to normal. Or it might be that they want to sort of, they've taken note of it, but it's not been a drastic enough change from previous results. Sometimes it just depends on the person, depends on what they're sort of presenting and what their blood test results look like. So another question we have is, I haven't had a review of omeprazole since before COVID. Now taking a statin 2, how often do I need a blood test for that? So with some drugs, there are obviously very specific monitoring requirements. A lot of blood pressure medications require us to check kidney function once a year. Statins sort of falls into an interesting group of medications where ultimately the most important thing to check is that we are checking that the medication is keeping your cholesterol levels down. So when you initially start on statins, we might get an annual check, or maybe a 6-monthly check, or maybe we'll check it after 3 months from starting taking it to make sure that the statin is having a good effect. But then after that, it can be that we don't need to check it, because once your cholesterol levels are nicely controlled, we don't need to worry about sort of checking it every time. It's just a case of if there's been any change or if anything sort of becomes different. And omeprazole, equally, there isn't any sort of annual monitoring in terms of blood tests, but this sort of falls into the group of medications which Usman talked about, where we have to just review that it's working well, it's doing its job, and there's not any sort of concerns or changes. So I would expect on both of those medications you to be getting possibly a phone call once a year from a pharmacist or from one of the medical team to sort of talk about that. But ultimately, not any more than sort of that. It wouldn't need necessarily an annual blood test. So please do keep asking your questions, by the way. Obviously, we'll try and get through all of them. We've got another sort of 20 minutes, 25 minutes or so. So the next question I was going to ask about is, I had a review about my long-term medication and you have taken them offline. I've seen a doctor who said it was back online, but it's not. The only way to use the comment box is to ask for another medication I don't need, but it's the only way to ask you. Usman, do you want to take that one?
Yeah, of course. So I think that once again comes back down to the NHS app. And when the medication is due for a review, you can't necessarily always see the medication that you're wanting because it's due for a review. Now, again, I can't really talk about the exact specifics without seeing the notes and exactly what's happened. But the normal process is, once you've had your long-term condition medication, you've had your long-term condition review. If you've got non-long-term condition medication on there, you'll then need a review with the pharmacist. However, if the NHS app isn't allowing you to see those medications that you're needing, you are correct. The only way to order it via the NHS app is to add a comment to the comment box stating what you do and don't need. Another way of getting around that is the system Voice Connect. Now, I'll just go into Voice Connect in a little bit. So Voice Connect is a system. It's a telephone line that's open 24/7. Now, to register for Voice Connect, you can go onto our online access. So if you go onto your surgery's website and if you select online access or digital front door, and it'll give you an option for something called Voice Connect. So to request a Voice Connect pin. So what that'll do, a request will go through to our prescriptions team, and they'll send you your Voice Connect pin. And whenever you need to order your medication, what you can do is dial a number which will be sent out to you alongside the pin. Once you dial that number, it'll ask you for the Voice Connect pin. If you type that pin in, it'll then read out to you a list of your medication. So, for example, it'll say press 1 for amlodipine, press 2 for metformin, and you will just press the numbers for the medication that you need. So that's one way around the NHS app. And I think that's also
Matt's just having some tech issues, so he's just gonna take a minute and just try and rejoin, and hopefully he can rejoin the conversation. Thanks for taking that question on Voice Connect. He's back. Can we hear you, Matt? No, that's a shame. Fine. So, in terms of another question, obviously, absolutely fine. If you aren't able to order your medications, please submit a comment, as Usman said, underneath one of the other medications that you're ordering, so that the prescription team can then investigate that. And as we talked earlier, one of their responsibilities is looking at the medications that are on repeat and sort of trying to work out what the next step is, whether that is they need a review, whether they need an appointment with somebody. That's obviously the next step for them. So another question that we have is about what to do if someone suddenly finds out that they've run out of medications or lose medication. How quickly can they get a replacement supply? This is something that actually can sometimes be misunderstood. We deal with medication prescriptions. Usually we aim for within a 48-hour window, 72 hours sometimes, depending on how busy it is, which is obviously 1 or 2 working days, maybe 3. However, if you are ever running out of a tablet, or you have none left for maybe a dose in the evening, or potentially for later on that day, the important thing is, or maybe it's a Friday afternoon, you need it for the weekend, it's absolutely fine to sort of come into the surgery and ask, and make sure it's really clear on whatever way you contact us that you're running out, because that can be escalated, as we said, to the most appropriate person very quickly to get dealt with urgently. Otherwise, it will sort of join the queue for 48 hours, which obviously, if we need it to be done sooner, we can do. And there's internal systems that we have to sort of raise that sort of urgency and make sure that it gets done before we get to that point. So the next question is from someone saying, I tried to order my repeat prescriptions early. The app advised me to contact the GP surgery, but I did this and I was told I need to call in the surgery and fill in a form. I went in today and was asked to write down details, e.g. meds, holiday dates, then the person's details in the prescription box. This took time and was awkward to do as I have a disability. Was there any way I could give this information on the phone? When will I receive the prescription if it's left in the box? So, do you want me to take this one, Usman, or do you want to?
I'm easy either way.
Fine. So in terms of how we sort of deal with this, holiday requests is something we deal with quite often. And what I would say is giving us a good 2 or 3 weeks notice before you're going away if you're going to need an early supply of your medication, or if you're going to need a supply that is longer than you normally get. It's definitely worth trying to get that down to a sort of a good 2 weeks before your holiday, just to make sure that Matt's team can have plenty of time to have a look at it and sort it out. And if not, they can obviously then pass that on to the pharmacy team, who'll then be able to do that. It's a difficult thing to sort of say what the exact process is, because also I don't know whether you're an AWC patient or not. But ultimately, trying to give people as much notice and information, whether that's a letter that you hand in, or whether that's something that you put through the online or through the paper slips, then that's also fine. That will take can sometimes take 2 days before that's reviewed by somebody. Just depends on how busy it's been over the weekend, because we always have a catch up on Monday morning where we're dealing with all the prescription requests that have been handed in over the weekend, because obviously we don't work over the weekend. So I think that answers that question. The next question I was going to ask is, someone's asked is there any way to synchronize all my various medications so they can all be ordered at the same time? Usman?
So the short answer is yes. If you put a request in saying that I'd like you to synchronize my medication, what we will try to do, there's 2 things that we can do depending on how out of sync they are. So if they're only slightly out of sync, what we'll do is we'll issue everything together, so that going forward everything will be due together at the same time next month. Now, if it's quite out of sync by quite a bit, what we might have to do is we might have to issue small supplies of some and larger supplies of some, so that everything's going to run out at the same time next time. Now, the reason why I said that's the short answer is because, unfortunately, the patients are always getting started new medications are getting increased, medications are getting decreased. So what we find is medications are constantly going out of sync. So if you find that's happening to you, we'll just go back to the short answer, put a request in, and we'll sort it out.
Yeah, I think sort of in reference to obviously what we're doing today in terms of talking about medication reviews, this is something that's perfect to bring up at a medication review with your pharmacist. We are very able, as Usman said, to sort of change how many you're getting, make sure that you're all getting the exact right amount, in the sense that let's say you got started on a new tablet halfway through your previous boxes, but got given a full box. We can obviously give half a box to sort of bring you back into sync, or maybe we can give 1.5 boxes of your other medicines to bring them into sync. So that's something absolutely perfect to bring up in medication review if that's something that you're struggling with. And if your medication review is not through that, then obviously you can get in touch with us outside of that period and obviously potentially organize an appointment. Maybe one of our pharmacy techs, one of our team members can help you with that as well. But that, if you submit an online form or get in contact with the surgery, that will be absolutely fine. That'll be passed on to the most relevant member of staff. The question sort of in response to someone said that they're quite concerned about mental health and how it's monitored and potentially the medications there are reviewed. I feel a call asking me how I'm doing isn't sufficient. So mental health is obviously a really growing and really difficult topic to talk about and really difficult topic to manage. We have a growing population of patients with mental health, and also there is a growing amount of information and guidance given to healthcare professionals to manage mental health. What mental health medications falls into those medications that are out of usually the LTC process. So they're usually medications that are reviewed by a pharmacist directly. Now, we've all had training in how to sort of make sure we're doing a sort of a good depression or anxiety review. And I must admit, there are certain people that you come off these reviews and you feel like the conversation didn't flow very easily. And sometimes it's a case that people don't really communicate well over the phone. Now, that is a really difficult thing that we have to navigate, as a predominant of our medication reviews are done over the phone. There are potentially options for face-to-face appointments if somebody really is struggling, potentially if they have hearing difficulties or if they have problems with maybe their sight, or maybe they have problems with sort of communicating, then we can obviously organize face-to-face appointments to arrange those reviews. And ultimately, what I would say is if there are concerns about someone's mental health not being managed correctly, please escalate that, raise that to the GP surgery, and we'll organise a review to sort of try and best navigate that as much as possible. I think an important thing to remember is that we are all just trying to make sure that patient safety is the priority, making sure that we're sort of optimising patient care as much as we possibly can. All right. So
just
the next
to jump in,
question.
sorry, on that one, Josh.
Okay.
I was just going to mention also as you mentioned, there are opportunities for face-to-face, and the telephone call for your review it can be a first step. So for a lot of patients, it does work. However, if it doesn't, there's places we can also refer it to. So it might be that a patient is suitable for our social prescriber, or a patient is suitable for referral to one of our counselling services. So even though it might seem that the phone call isn't working for yourself, that phone call can be the start of the next step.
Yeah, very good point, Usman. Yeah, as you said, we have a very varied team here through AWC Modality and across all of the modality practices, where there are people, as we said, who are more qualified than us to deal with sort of helping people with their mental health. And that's when, if we have concerns, we can escalate to the GP, or we can escalate, as you said, to the social prescribers, to the nurses, to anybody who's sort of better suited to managing that. The next question was, ordering via NHS's app is not always possible for some people at surgery. It is at the surgery. It's not taking requests at reception. What solution do you propose? So Maria, we have a question here about how best to order medications. If you've just joined us, I'd recommend looking back at the slides. We have a couple of options when it comes to ordering medications. The big ones being Voice Connect, which is an online phone service, which allows you to sort of do the prescription over the phone and order anything that's on your repeats already. And then, although we don't take prescription requests at reception, you can always do a paper slip with your name and date of birth on it and leave it in the envelope outside of the surgery. There's always a post box that you can post through. That does take a few extra days to process, but it does still get processed. And every prescription request is looked at. Next question. Someone's asked about what slimming medication is available on prescription. This is obviously a big buzz topic at the moment. Usman, are you aware of any sort of that at the moment?
So I think what a lot of people are interested in at the moment is the injectables. Now, it is like Josh mentioned, a buzz topic at the moment. There's a lot about it in the news, but at the moment, we don't prescribe weight loss medication without patients being on some kind of weight loss service. So I believe there's multiple tiers to the weight loss service as well.
Yeah,
so more likely than not, we'd start off with the GP review. In regards to your weight loss, you may be referred into a weight loss service if appropriate. There are certain weight loss tablets that are available on prescription, but again, the GP would need to assess your suitability for that. And I think it's part of the tier 3 of the weight loss service, where it may be that they prescribe some of the injectables or the Ozempics, if suitable. There are some, you may see some people with some of these medications on repeat. However, more likely than not, that is probably for diabetes rather than weight loss. And even with the diabetes medication, it's at third or fourth line, so it's only once quite a few medications have been tried and failed that they may consider that.
Yeah, I think that's a really good point. Is a lot of the medications that are used for weight loss are actually diabetes medications predominantly. So in the GP surgery and primary care, we tend to see only patients who are being managed for diabetes, usually on those medications. A lot of the weight loss stuff is more specialist and often requires referral or potentially further investigations. We've had a good question about, obviously we mentioned social prescribers. So social prescribers are basically sort of a team of different people from lots of different backgrounds who work with our patients with any sort of problem. So I know that one of the social prescribers we have is sort of a dietitian, or someone who focuses a lot on sort of dietary management, and that she's really good at helping people with weight loss and sort of lifestyle changes that can be used to sort of manage that. There's also social prescribers that do more sort of mental health and well-being checks and sort of have a regular conversation with patients, keeping up with them in terms of sort of making sure that they're sort of making good changes in their lifestyle to try and improve their mental health. And they're a really, really varied team. And I think the best thing, if you're interested in potentially getting support from them, we have the Holly Health app, which you might have received some information about. that is a similar service that's sort of an online version of a social prescriber. But basically anything that happens in that app, we can also potentially offer support with through our social prescribers as well. We are sort of coming to the last sort of 10 minutes or last 5 to 10 minutes or so of this Facebook YouTube live. So I'm just going to keep on working through the questions. So if you've got any last minute questions, we're going to try and quick fire through them. The next question is about Christmas is coming up. What are the plans to manage repeat prescriptions in line with surgery opening and closing periods? Now, you've just said the dreaded words. That is the big thing that we deal with every single year. Christmas is always a busy period for us. But patients are much better at managing Christmas ordering than they are their Easter ordering. People get a lot more surprised by Easter, so people tend to order their medications quite late around Easter. But around Christmas, we tend to get quite a lot of people ordering their medications early. And our teams, particularly Matt's team and the social prescribing, and the prescribing admin team, are sort of aware that they can issue prescriptions early around the Christmas period. So what I'd recommend is if your prescription is due for delivery or is next due to be collected in the period between Christmas and New Year, what you can do is you can ask for it a couple of weeks early to make sure that it's ready and available before the Christmas period, and you can collect it before Christmas so that you don't have to worry about it until the new year. What I'd say is sort of being preemptive and ordering slightly early and being aware of when you need to get your medications is the best thing to do. Okay. Another question we have.
Just to try to jump in very quickly on that one, Josh. I think a lot of patients get confused and think we might be closed for the entirety of the Christmas break. We are only closed on bank holidays. So whilst Josh is right, please be on top of it. Be proactive to manage your medication. If for whatever reason it's near Christmas and you still haven't ordered it, don't worry, we will be open. It's just the bank holidays that we're closed on.
Yeah, and also obviously with a lot of people traveling to see family, we also get quite a few questions, quite a few requests potentially of, oh, I've left my prescription at my grandma's house, or I've left my prescription at my parents' house. Please, can I have an extra supply? And as Usman said, we are open any days that aren't the bank holiday. So don't worry, if you do need us, we will be open. It's just the bank holidays when we're closed. On
bank holidays, if we're closed, you can still get a hold of your medication. There are certain pharmacies that will be open on Christmas Day, on Boxing Day. And I know people hear the words 111 and think, oh no, we're going to have to wait ages in the queue. 111 have a fantastic service for medication and forgotten medication or lost medications, either online or via the telephone. And because it's somewhat of a separate service to the normal service, the wait is nowhere near as long, especially if you're doing it online. And it's a fantastic way to get a hold of medication quickly if we are closed.
And that actually really moves on to this next question very well, which is a question from somebody about what kind of common health issues can we seek to help ourselves with or using a community pharmacy? And this is something that has been going around, again, a bit of a buzz topic. Pharmacy First has obviously been advertised quite a lot over the country. But Usman, can you speak on a couple? I know that you've worked quite a lot with the community pharmacies about this. Can you speak on those?
Yeah, no, definitely. You'd be surprised at how much pharmacies can actually do in a community pharmacy. So majority of the common ailments that you can think of, so your common colds, your pharmacy can deal with. Nowadays, even thinking like UTIs, so you wouldn't think it's something that a pharmacy can deal with. However, the new services that are available at pharmacies and community pharmacies in particular, so community pharmacies can deal with UTIs and uncomplicated UTIs. They are able to prescribe 3-day prescriptions for. Now, I'm not saying that you necessarily every patient that goes there, they're going to get a prescription for it. Suitability will be assessed. However, there are qualified clinicians at pharmacies, so more often than not. So I mean, of course you've got your minor things. Like let's say you've got a rash or allergies,
sore throat.
Again,
sore throats.
Yeah. So a lot of, especially this time of year, there's a lot of colds and flus going around, and more often than not, it is going to be viral. It's going to be something that you don't need antibiotics for, and it's something that the best thing for is a lot of keep yourself hydrated, a lot of rest, and homely remedies that are available from the pharmacies, your Lemsips, if you've got if there's your sinuses, your Sudafeds, and that kind of thing. But yeah, no. Community pharmacy is a fantastic resource.
They're more and more equipped, aren't they? They're more, and also a big part of it is that pharmacists are now being trained to be prescribers, so we're able to write our own prescriptions from the moment we come out of university, which means that we'll be able to be more helpful, and community pharmacists will be more and more helpful, hopefully, over the coming years as that sort of gets integrated into all of the pharmacy services. So I think we are coming nicely to the end of our sort of Facebook Live. But I think that is everything. So I wanted to say a big thank you to Usman and also Matt, who did join us. Unfortunately, his computer sort of seemed to have a bit of a freak out. So unfortunately, he's not been able to join back again. But I'm sure he'll be very happy to say thank you for everyone for coming and joining with us this evening. Obviously, a big message that we wanted to obviously nail home is that the pharmacy team and the prescriptions team deal with an awfully large amount of work. But know that we are your first point of call if there's any questions about your medications. So please do not hesitate. If you need to organize your medication, you can get in touch with us and sort of organize that. And I wanted to say thank you to my colleague Usman for joining me as well.
You've been a brilliant host, Josh, and thank you everyone for joining us tonight and your questions.
Yeah, and thank you very much for also engaging in the Facebook Live. It's been great having questions on here. And obviously, if there's anything else that you need to ask us, then there might be some people that respond to some of the questions in the comments after the Facebook Live has gone on. Because if you're joining us afterwards, then obviously if you're watching this in your own time, then please feel free to come onto the Facebook page or onto the YouTube, and you can watch the video back if there's any other things that you potentially missed. Maybe you missed the beginning of it, and obviously let us know. All right. So thank you very much, and I hope everyone has an enjoyed and lovely evening. I know I'm about to go and have my dinner because I'm starving. All right, see you later. Thanks a lot, Usman. Thank you, everyone. Bye-bye.